Nigeria's government treats 50,000 people living with HIV and AIDS out of nearly 2 million patients in the country. President Muhammadu Buhari has promised that his administration will continue to prioritize health interventions to address killer diseases and public health emergencies. The president made the promise on Tuesday in Abuja while launching a 62 billion naira HIV trust fund of Nigeria to help Nigeria end AIDS as a public health threat and place more people living with HIV on treatment annually. The report.
About $6.2 billion has been spent on HIV response in Nigeria. About 80% of the funds were contributed by external donors, mainly the U.S. AIDS Relief and the Global Fund to fight AIDS, tuberculosis and malaria. The private sector contributed 0.1% to 2% of total funds, with the rest of funds provided by the Nigerian government. Launching the trust fund, President Muhammadu Buhari said at the last United Nations General Assembly high-level meeting on HIV and AIDS, he called for a renewed global action to address the HIV and AIDS epidemic in Africa, noting that ending AIDS as a public health threat in Nigeria will require increased domestic funding.
We have continued to make good our commitment of placing more people living with HIV on treatment annually using national resources. However, strong domestic resources mobilization with an enduring partnership and shared responsibility is required to sustain the response to HIV and other emerging public health emergencies. Our purposeful partnership with the private sector in our response to coronavirus pandemic provide a readily available financing solution that we can leverage on to sustain the HIV response.
He commended the National Agency for the Control of AIDS and the Nigeria Business Coalition Against AIDS for their efforts in establishing the HIV Trust Fund of Nigeria to secure a generation of babies free of HIV. Secretary to the Government of the Federation, Bas Mustafa, said the launch will guarantee funding from the private sector-led resources for HIV interventions, especially for the elimination of the mother-to-child transmission of the virus.
The establishment of a private sector-led coalition against COVID-19, CAR-COVID, clearly demonstrates private sector's renewed commitment to support national response to emergencies and pandemics.
Today marks an important milestone in building a coherent strategy for private sector engagement against HIV/AIDS. As we launch this fund, I am reminded that we have about 2 million of our compatriots living with HIV/AIDS. And it is our collective responsibility to bring this number down to 0. We have heard what the problem is, what the facts are, and the rationale for the HIV Trust Fund of Nigeria. I don't need to go over them. My job is to encourage all of us to contribute to this $100 million fund that will be led by our very able Dr. Chikwe Ozomeni.
Also speaking, the Director General of National Agency for the Control of AIDS, Dr. Gambo Aliyu, said within the last 3 years, the agency has identified and placed on treatment an additional 900,000 persons living with HIV, bringing the total number of Nigerians on HIV treatment to 1.7 million. The Director General, while justifying the need for the fund, said providing lifelong treatment to all persons living with HIV, even after successfully stopping new HIV infections, would require a domestically sustainable financing mechanism.